Hey everyone, and welcome back to the channel. Today, we're diving into a topic that's incredibly important for every single one of us, no matter our age: calcium. We all hear about it, we know it's good for our bones, but do you really know what happens when you're not getting enough? The signs of calcium deficiency can be surprisingly subtle at first, but they can lead to serious health issues down the line. That's why today, we're going to break down the telltale signs that your body might be crying out for more calcium, explain why this mineral is an absolute powerhouse for your health, and of course, talk about what you can do about it. So, if you've ever felt unexplained muscle cramps, brittle nails, or just a general sense of fatigue, you're going to want to stick around. This isn't just about bones, it's about your entire body's well-being. Let's get started. First, let's talk about what calcium actually does. Most people immediately think of strong bones and teeth, and you're absolutely right. About 99% of the calcium in our bodies is stored in our skeletal system, acting like the foundational framework that supports us every single day. It's what gives our bones their density and strength. But what about the other 1%? That tiny amount is circulating in our blood and soft tissues, and trust me, it's doing some heavy lifting. This free-floating calcium is essential for so many vital functions. It helps our muscles contract, which includes the most important muscle of all, our heart. It plays a key role in nerve transmission, allowing our brain to communicate with the rest of our body. It's also involved in blood clotting and even helps regulate certain hormones. So you see, calcium isn't just a bone builder. It's a master regulator that keeps our body's systems running smoothly. When we don't get enough from our diet, our body has a clever, but ultimately damaging, backup plan. It starts pulling calcium from our bones to maintain that crucial 1% in the blood. Over time, this constant withdrawal weakens our bones, setting the stage for problems later on. So, how can you tell if your body is running low on this essential mineral? The early signs can be easy to miss or blame on something else. One of the most common early indicators is muscle problems. You might experience frequent muscle cramps, especially in your legs, back and arms. These can happen during the day or wake you up at night. You might also notice muscle aches or spasms. This happens because calcium is vital for proper muscle contraction and relaxation. Without enough of it, our muscle fibers can become overly excitable, leading to these involuntary and often painful movements. Another subtle sign to watch out for is extreme fatigue and lethargy. If you feel tired all the time, even after a good night's sleep, it could be linked to low calcium levels. This overall sense of sluggishness can impact your energy, your mood, and your ability to get through the day. While fatigue can have many causes, a calcium deficiency should definitely be on the radar if you're experiencing it alongside other symptoms. Now let's look at some more visible signs, which often show up on your skin, hair, and nails. Calcium plays a role in skin health and cell regeneration. A deficiency can lead to dry, itchy skin. Some people with chronic low calcium levels may even develop skin conditions like eczema or psoriasis. Your nails might also give you a clue. If they become dry, brittle, and break easily, it could be a sign that you're not getting enough calcium. Similarly, while many factors contribute to hair health, severe calcium deficiency can sometimes manifest as coarse hair or even patchy hair loss in a condition called alopecia. It's your body's way of showing you on the outside that something is lacking on the inside. As a deficiency progresses from mild to more severe, the symptoms can become more alarming. One of the classic signs of significant calcium deficiency is numbness and tingling sensations, particularly in the hands, arms, feet, legs, and around the mouth. This is directly related to calcium's role in the nervous system. Without enough calcium, our nerve signals can misfire, causing these strange sensations, known as paresthesia. Another serious symptom is related to your heart. Remember how calcium helps regulate muscle contractions? That includes your heartbeat. A severe deficiency can interfere with the heart's electrical signals, leading to an abnormal heart rhythm, or arrhythmia. This might feel like a fluttering in your chest or a skipped beat. This is a very serious symptom, and if you ever experience it, you should seek medical attention immediately. Of course, the most well-known consequence of long-term calcium deficiency is its effect on our bones. When our body constantly borrows calcium from our skeleton, our bone density decreases. In the early stages, this is a condition called osteoporosis. It means your bones are weaker than normal, but not yet at the point where they break easily. However, if left unaddressed, osteopenia can progress to osteoporosis. Osteoporosis is a serious condition where bones become so brittle and fragile that even a minor bump, a cough, or a sneeze can cause a fracture. The most common fractures occur in the hip, spine, and wrist. This is why maintaining adequate calcium intake throughout your life, not just in childhood, is absolutely critical for your long-term mobility and quality of life. Another area that gets hit hard by low calcium is our dental health. Your teeth, just like your bones, store a significant amount of calcium. When your body is deficient, it can pull calcium from your jawbone, which can weaken it and lead to loose teeth. It also increases your risk for tooth decay, as the enamel isn't as strong. Irritated gums and brittle teeth are also common signs. So, if your dentist is suddenly finding more cavities than usual, it might be worth considering your calcium intake. So, Who is at risk for calcium deficiency? Several groups of people need to be extra mindful. Postmenopausal women are at high risk because the drop in estrogen levels accelerates bone loss. Individuals who are lactose intolerant or have a milk allergy often struggle to get enough calcium because they avoid dairy products. Vegans and vegetarians also need to be strategic about their food choices to ensure they're getting enough plant-based calcium. People with digestive disorders like celiac or Crohn's disease may have trouble absorbing calcium from their food. And finally, as we age, our body's ability to absorb calcium naturally decreases, so older adults need to pay close attention. Now for the most important part, what can you do about it? The best approach is always through your diet. So, let's talk about calcium-rich foods. Dairy products like milk, yogurt, and cheese are famously high in calcium and are easily absorbed by the body. But if you're dairy-free, don't worry, there are plenty of fantastic options for you. Fortified plant-based milks like almond, soy, or oat milk are excellent sources. Dark leafy greens are your best friends. Think kale, collard greens, and spinach. Canned fish with bones, like sardines and salmon, are calcium powerhouses. Beans, lentils, and certain seeds like chia, sesame, and poppy seeds are also packed with this mineral. Tofu that is prepared with calcium sulfate is another great choice. The key is to include a variety of these foods in your diet every single day. For calcium to be absorbed effectively, it needs a partner. Vitamin D. You can get all the calcium in the world, but without enough vitamin D, your body can't use it properly. Our bodies produce vitamin D when our skin is exposed to sunlight. But for many people, especially those in colder climates, that's not enough. You can also find vitamin D in fatty fish, egg yolks, and fortified foods like milk and cereals. Often a combination of safe sun exposure, diet, and sometimes a supplement is the best strategy. Speaking of supplements, should you take one? This is a really important question, and the answer is, it depends. You should always, and I mean always, talk to your doctor or a registered dietitian before starting any supplement, including calcium. They can assess your diet, your risk factors, and maybe even do a blood test to see if you truly need one. Taking too much calcium can have its own risks, so it's crucial to get professional guidance to find the right balance for your individual needs. To sum it all up, calcium is an unsung hero of our health. Its job goes far beyond just building strong bones. It keeps our muscles moving, our nerves firing, and our heart beating steadily. The signs of a deficiency can range from subtle muscle cramps and fatigue to more serious issues like abnormal heart rhythms and osteoporosis. The good news is that for most people, this is preventable through a balanced diet rich in calcium and vitamin D. Pay attention to your body, listen to the signals it's sending you, and fuel it with the nutrients it needs to thrive. Your bones, your muscles, and your heart will thank you for it in the long run. Thank you so much for watching today. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up and consider subscribing for more health and wellness content. And I'd love to hear from you in the comments. What are some of your favorite calcium-rich foods? Let's share some ideas. Stay healthy, stay strong, and I'll see you in the next video.